Welcome to the Health Priority Podcast, sponsored by eClinic Africa. In today's episode, I am honored to speak with Dr. Beatrice Wiafe Addai, who is a global leader in breast cancer advocacy and a founder in Breast Care International. This is my first time meeting her, so I'm very, very happy to speak with her. So, Dr. Yafi, thank you for giving me this opportunity to talk to you.
It's indeed a pleasure to have you.
Thank you.
And let me congratulate you
Thank
for being
you.
the first runner for the Miss Health Ghana.
Yeah, thank you so much.
To talk about health is noble.
Yeah.
Because our health is our wealth.
Yes.
And we don't normally talk about health, even though it's the driver. Without health, you are nobody.
Yeah.
And so when I see young people coming into the health field, it's encouraging. And it also tells us that the future is bright.
I'm so honored. So, I'll start with your foundation. I want you to tell me what inspired you to start this.
Okay, so before I get to that, let me acknowledge the C4, which is the Comprehensive Cancer Center of Excellence in the Cloud. And Breast Care International and myself happen to be key partners in the C4. C4 is powered by AI.
Okay.
And we intend to collaborate with Comprehensive Care, which is another AI-powered tool, and which is going to help us in the advocacy and the care that we give to our patients. Incidentally, breast cancer happens to be the most common cancer globally.
Yeah.
And when we come down to Ghana, it's also the most common cancer. It affects women mostly.
Yeah.
But we have a few men who also develop breast cancer.
Oh, so you have men in there?
We have men survivors. Just that the men are so scared to come out. So
they are shy.
They are shy. So we have a lot of breast cancer survivors. Unfortunately, breast cancer is normally diagnosed late when you come to the low and middle income countries. And there are a lot of myths and misconceptions surrounding the disease. A lot of people think it's caused by witchcraft, it's a spiritual disease.
True.
And so they do all sorts of things until the
It's
disease
late.
has already left the breast and has metastasized. It started a long while ago. In fact, Breast Care International was founded in 2002, registered in Ghana, and now it's all over. At the time, I happened to be the first Ghanaian female general surgeon. Okay. And as a resident surgeon at Konfanochi Teaching Hospital, I realized that a lot of our women were coming too late. Yeah. And the trigger was a 41-year-old woman who was brought in on the stretcher with bone metastasis, lung metastasis, liver mets.
Oh, that's late.
So it was too late. And when I asked her why she's coming so late, she told me, "Doctor, I didn't know. I didn't know that painless lump was going to end me like this."
So as of 2022, does that mean that the education
wasn't there? There was no education whatsoever. In fact, that woman sent a strong message to me that, okay, it means that women are coming late because they don't know.
Yeah.
So straight from my consulting room, I went to a friend of mine, a senior friend, Jofel, the owner of Jofel Catering Services. Okay. I went to her and I told her, I think I need to go to the churches and start to talk about breast cancer. So she took me to her church, the Garrison Presby Methodist. From there, I don't know if you've heard about one Nana Hayford. an
Yeah,
actress.
yeah.
She was having a program on Fox FM. So we went in the night and she gave the program to us. So I spoke
We spoke
about
about it.
breast cancer. That
Okay.
was my first outreach on the radio. And the kind of questions people started asking.
Could
In the
tell.
church too, the kind of questions they started
Could tell they
asking.
have no knowledge.
No idea, no knowledge. Because everybody thought that whatever happens to the breast is an abscess.
Oh yeah.
So they have to go and look for herbal treatment to
Yeah.
apply.
And some too can't differentiate the normal lumps in their
No.
breast.
In fact, even up to now, people think that the breast is a lump. They say that in our local parlance, they will say "Obabienu fujuawum," which is wrong. It's the way our languages, sometimes it's difficult for us to explain things. And so they take it that whatever they have, which is the breast tissue, is a lump. No, a lump is a lump. It's different from the breast that starts on a woman's chest. So that was the time I started the outreach programs.
Okay.
So I had to train nurses, doctors who were passionate about it. And also at the teaching hospital in Konfanoche, we didn't have any breast unit. And so both men and women were coming to the consulting room together. And so you'll be examining a woman's breast and the man can walk in with a POP on his hand. He's also coming to clinic anyway. So I approached the administration. I said, no, we need to have a separate unit. They said there was no money. That's the usual thing in Ghana. So I wrote to the Social Investment Fund, made a strong point. And they said, okay, I have to pay 10% of whatever costs I needed. And they will give me the 90%, which I did. And so if you go to Konfanoche Teaching Hospital now, the breast unit is the one that I put up.
Oh,
and
good.
It's still being used. I'm happy they are still using it. That was before I moved to start my own practice.
So here at Peace and Love Hospital.
Yes,
okay.
It's my own practice.
Okay.
And I also have a branch in Accra on the Spintex Road.
Okay.
It's also Peace and Love Hospital.
Okay.
The Breast Care International goes to the communities.
Yeah.
We go to the churches. We go to schools.
The marketplaces.
Wherever we find women, we go, we educate them, and we put every woman down to examine her breast.
Okay.
This is because breast cancer is not painful at the beginning. So a woman can have a lump in her breast. She can have some abnormality. She can have peau d'orange.
I feel it's normal.
Because there's no pain. Once there's no pain, our women or our people think there's no danger. And Ghanaians are not worried, except they see blood. It's when they see blood that they get worried, or when there's pain. When somebody has a toothache, nobody asks the person to go to the dentist. You will go because of the pain. But breast cancer is not painful until it has spread. And that's the reason why creating awareness among the populace is very important.
So to talk about creating awareness, we know that October is when we create awareness on breast cancer. But here's in a case after October, that's it. What are some of the challenges that you face in creating awareness on breast cancer?
Thank you for this. I always complain when in October you find a lot of organizations springing up, like mushrooms,
places, schools.
Yes, everybody is doing something in October, and right after October, everyone goes to sleep. Breast cancer doesn't start and end in October. Every day. In fact, research now has it that every 50 seconds, a woman somewhere is diagnosed with
50 seconds.
50 seconds. It used to be 69 seconds. Now it has dropped to 50 seconds. And every 19 seconds, a woman somewhere dies from breast cancer.
What do you think? What's not in the right place?
We are not taking the disease as serious as we should take. In fact, in the low and middle income countries, the cancers and the non-communicable diseases are not on the priority list as they should be. When you go to the developed countries, they know what cancers can do.
Yeah.
They've placed a lot of emphasis on cancer control. And so screening is very important to them, because if you want to catch cancer early, you have to screen.
Yeah.
If you don't screen for them, it will take a long time for you to identify it and even take action. And so for us in the low and middle income countries and in Ghana, where we are very superstitious, when we think that everything is caused by somebody, we need to try and educate our people and demystify breast
Some of
cancer.
these misconceptions.
Yes,
Yeah.
it's too much,
And it's sad that when you get it, nobody wants to come around you.
Yes, we have made it like it's your own problem, which is wrong. The woman with breast cancer shouldn't face the disease on her own. It's not supposed to be her problem or the problem of her children and her family alone. The country should come together and rally behind such women, because that is the time they need us.
Yeah.
We don't have any strong social support system in our country.
Most of them are ignored by their husbands, by their children.
They divorce them. It's not that they ignore them. A lot of breast cancer survivors have their husbands already gone. They just pick their bags and it's like they will come tomorrow. They disappear. And
That's
so
sad.
that is part of the education that we are doing.
Yeah.
The woman should not be punished.
The stigmatization around
The
this.
stigma, the fear, the fact that there's no support for such women is very sad. But I always tell the men that you should treat your wife the way you want someone to treat your sister.
Yeah, imagine yourself that if you were the
Yes,
one in her
yes.
position.
And this is a disease that we still don't know the cause. And so we cannot do what we call primary prevention. We can only do secondary prevention.
And what are some of these secondary preventions?
Best secondary prevention is early detection.
Oh, yeah, so
and
you screen
prompt
most of the
action.
time.
So I always advise men that they also have a role to play
Yeah.
in breast cancer fight. They should support their wives.
Yeah.
They should actually be there for them. The woman has committed no crime.
Yeah.
And breast cancer, like prostate cancer, is a disease that we don't know the exact cause.
Yeah.
So we should be ready to be there and to support each other when these cancers
thrives. So I want to ask, throughout this journey, what are you most proud of?
We are not there yet, but I must say that God has been good to us. Since we started, we've touched a lot of lives.
Yeah.
We've changed a lot of misconceptions. We have some patients who are coming earlier than before. And so if you look through our survivors, we have those whose breasts have been preserved.
Okay.
And we have those who had to have their breasts removed. The important thing is the woman lives, a fulfilling life after the diagnosis. So the fact that the woman has lost the breast, one or two breasts, doesn't make her less of a woman or a human being. So it's important to know that we have a lot of things to do. We hope that we'll be able to open offices throughout all the regions. We have survivors in all the regions, but we need to train nurses in these regions who will stay there and educate the people in their local dialects, because sometimes you travel to an area and you need an interpreter before you can.
I had a patient who was deaf, And at that time too, I had learned sign language, so I had to, but it was really hard for me.
Yeah. And we have survivors who have all the challenges, some who are using the wheelchair
Yeah.
because they've lost their limbs. We
Oh,
have some who are blind. We have some who are deaf, dumb. So breast cancer is no respect of persons
yeah.
anyway. But we believe that with the efforts we've made so far and the collaborations with the global cancer world, because we are part of the partners with the Global Health Catalyst Summit.
Okay.
And we also we actually wrote the Lancet Oncology Commission's report on Sub-Saharan Africa. And we hosted the first launch in Ghana. Breast Care International hosted the
Okay.
event. At the time, we had 3 lead commissioners on the Lancet Oncology Commission. Professor David Kerr of Oxford, Professor Will Ngwa of Johns Hopkins and Harvard,
Okay.
and Dr. Beatrice Wiafe Addai as the 3 lead commissioners. And then we had 51 more commissioners, 50% from Africa,
Okay.
50% from the diaspora, 50% female, and 50% male.
Okay.
And we put up this book. We showed a lot of negativities,
Yeah.
The narrative about cancers in general in sub-Saharan Africa
Oh, yeah.
is very bad. And so we had some calls to action, which we are taking some seriously.
Yeah.
And so we've started working towards the establishment of the Utumfo said to the second Comprehensive Cancer Center of Excellence
Okay.
in Kwaso, near Kumasi, where we are going to treat all cancers. Ghanaians should not be forced to travel to India,
Yeah, other
Germany,
countries to seek help.
UK,
Yeah.
US to seek help. It's only a few who can do that. What about the majority who cannot travel outside?
Yeah.
So we should have our own stand-alone Comprehensive Cancer Center of Excellence. And together with the Comprehensive Cancer of Excellence in the cloud, the C4,
The C4.
and with the help of AI and telemedicine,
Yeah.
we're going to do the same kind of treatment that is being done in Johns Hopkins,
Yeah, at least,
Harvard,
yeah.
so that whilst I'm doing surgery here,
Yeah.
a colleague can be in Harvard or Johns
Yeah,
Hopkins
to care for a
and
patient.
see what
Yeah,
we are
was
doing.
Okay.
And, kind of give their inputs. In so doing, we'll be training our local scientists, our local professionals, because we realize that when a lot of our professionals travel abroad, they don't come back.
Oh, but so recent encounters with most of these young doctors, I think most of them are interested in cancer.
Yes, yes. I mean, it's very good.
Yeah.
But we need to have the right equipment. We need to
Yeah.
have the passion for it. We need to be able to say that I want to care for my own people.
Yeah.
We cannot all go out there.
Because of the system.
Who will take care of our own people?
Yeah.
So that's why we have to provide the things that make people run away.
Yeah.
We need to provide the right environment, the right equipment. We need to empower people with the right knowledge so that they can feel comfortable working within the system.
Yeah.
If we don't do that, we will produce 1,000 and we will lose 1,000.
Yeah.
So what we are doing now, trying to do is, we are not lamenting on brain drain anymore. We are talking about brain recirculation and brain drain. And so if you go to, let's say, University of Washington in Seattle,
Yeah.
Dr. Afuadu Chumwa York is bringing her brains back.
Yeah.
Professor David, yes,
Yeah.
Professor Wolungwa, who has invented the use of micro drones in immunotherapy for cancers. He did that in Harvard and Johns Hopkins. He's originally from Cameroon.
Okay.
And so
He's impacting the
the knowledge, and he's the founding director of the Global Health Catalyst.